So Better Health of the Bush for us is very much about equity of access to primary care services, and that's really what we're about. And we know that in rural areas we have many GPs, allied health, primary care nurses, all working really hard. But access can be limited for people in rural areas, particularly in small sized rural towns. So what we're trying to do is to look at how do we bring services together, how do we increase the collaboration in the primary care sector to really enable better access to primary care.
Lack of doctors in town here is a problem. Professional services and allied health services as well. So if someone needs to go to Armidale for professional services or to see a specialist, that happens, or Coffs Harbour, or out of the district altogether, this is something that is a problem for us. Council's plan is to have better health in town and have access to doctors in town. We've done a lot of work with Better Health from the Bush since I've been in council for the last 2.5 years, and our executive continue to meet with Better Health from the Bush in trying to work out ways for us to get more doctors and allied health in town.
In regional and rural areas, we know that we can't keep doing the same because gradually we're seeing retirement of some of our key primary care clinicians, and we're seeing that access to primary care services in some areas is getting harder and harder. So this model is really interesting because what we're trying to do is bring a primary care team together. So doctors, nurses, allied health, and have a hub where people can come and see a multidisciplinary team.
For an example of how Glen Innes Health Hub will work, let's look at Mark. Mark, aged 55 from Glencoe, a town 24 kilometres south of Glen Innes, lives with chronic pain. Mark books an appointment with his existing GP, and at the appointment, the GP refers Mark to the Health Hub's group appointment for the exercise physiologist, as well as access to the Care Navigator service. Mark attends the group appointment with 6 other patients who also live with chronic pain. Mark learns about exercises to help with his chronic pain, and questions are asked by other patients that Mark hadn't thought of, but are relevant to him. This improves Mark's understanding further of how to manage his condition. Mark also meets with the Care Navigator, and they connect Mark with a local walking group, a men's group, and a dietitian online via telehealth. Mark feels supported and easily makes lifestyle changes through the Health Hub support and connection with local and online services.
And what we're doing as a PHN is we're facilitating that. We're bringing local people and providers together to discuss, well, how can we really make this service work for the local community and how can we make it sustainable?
People will have access to doctors and allied health, and that's great for our community and great for our town.
I think we're all really optimistic that there'll be a whole range of benefits for the community. Increasing access for people in the community of Glen Innes to health services. Locally, they might be able to have those face-to-face contacts in a timely way, but in addition to that is the opportunity for virtual healthcare. So rather than travelling the 5-6 hours to Newcastle for a specialist consult or review, they can come into the hub, they can be linked up with a specialist, with an allied health or a nursing or a medical support locally in the room with them, but linking into that virtual consult. I think there's some great opportunities there for our community to save them time of travel that's unnecessary, have their healthcare locally, but also have local clinicians that they know and trust beside them.
QNE was involved with the Better Health for the Bush initiative since its inception. We come at it from the position of an educational partner, partnering with our clinical partners, the PHN and the local health district. As an educational provider, we can offer opportunities for clinical staff to be involved in training medical and health students, and equally we can provide some educational opportunities for the clinicians who are involved in the project. We know that residents in the New England Northwest have worse health outcomes compared to other parts of New South Wales and Australia, particularly metropolitan areas. And a lot of that comes down to access to health providers. So we have a paucity of health professionals in Glen Innes, and we'd like to increase access for the community of Glen Innes and its surrounds. One way of doing that is to offer different models of care that might utilise the skills of alternative health professionals other than doctors to work at the top of their scope in a regional area.
What it brings is it brings a level of engagement and local ownership that makes a service much more sustainable, but also helps a service to meet the local community needs. We just want to support the service as an organisation. So we're supporting the service provider, the local community. We'll give it the extra support that's needed to make sure that it works and it's sustainable. For people in the community who are watching this video and you're thinking, oh, maybe I could get involved, we'd love for you to be involved. We actually need you to be involved. We need the local community to really rally around this and help to make it work. So we encourage you to reach out, get in touch with us, have a look at the contact details on the website, get in touch, and we'd love to work with you.